Good evening, everyone, and welcome to HRO's policy panels Monday evenings this October. I'm going to give everyone 2 to 3 minutes to start joining us before we begin tonight's policy panel. So please give us your patience while we let everybody into the meeting that would like to join over the next 2 to 3 minutes. Thank you. Okay, I think that it is a good time to begin this evening's panel. Again, thank you everyone who's joining us and continues to join us this evening. I would like to start this evening by introducing the folks who will be speaking to you tonight, our panelists. First is Gary Daniels. He is the chief lobbyist for ACLU of Ohio, where he has worked for almost 25 years. In between his time working for ACLU, he lived in New York City and worked under the National Coalition Against Censorship and the Center for Constitutional Rights. Most of his legislative work is deliberately based in mass incarceration issues. Thank you so much, Gary, for being here tonight. Also joining us tonight is Sara Blake. She has spent the greater part of her life in Zanesville, Ohio. She is passionate about her community and advocating for others. And she's meeting people where they're at. Sara is a candidate for a Bachelor of Social Work from the Ohio University in 2023, and she is currently employed at a behavioral health agency with plans to be a mental health substance use disorder counselor after graduation. Thank you so much for joining us this evening, Sara. And also we have Allie. She is our Harm Reduction Ohio Public Policy Fellow. Through her fellowship, she researched Ohio drug courts and published a report on her findings. We will share a link in the chat for where you can find that report on our website. She has lived across Ohio, but she is currently in Massachusetts at Wesleyan College, and she is a junior and a sociology major. And after graduating, she hopes to advocate for drug users in Ohio and our carceral system. So thank you so much, Allie, for also being here, writing your wonderful report so that we could have this policy this evening. Okay. I wanted to sort of talk about kind of what we're doing here tonight. What are drug courts? Can we start just kind of describing like what drug courts are? Any of our panelists are welcome to answer that question.
I'll take a crack. Drug courts they've been around now for essentially a generation of people. And the idea behind drug courts is that it recognizes that one size does not fit all, and that if all you're basically doing is rubber stamping drug defendants in court and sending them off to prison and jail without doing further examination of their situation, that perhaps some things might work for them that might not work for other people. The idea is for the judge and for the courts to provide that flexibility and that not one size fits all approach. But of course, you expand back a little bit, take maybe a 30,000-foot view of this, and it could be argued that it kind of is a one size fits all approach because drug courts by necessity involve the criminal legal system. So you're dealing with police and prosecutors and courts which can bring up their own, let's say, challenges or other types of things that begs the question of, is the design of drug courts the way that Ohioans and Americans and everybody else should go with this? So obviously with this event, we'll be talking about all these types of issues, but basically in Ohio, it's a specialized docket. We have lots of specialized dockets here for veterans, for families, for juveniles, for a variety of people. And we also now have drug courts across the entire state, essentially.
Right, just kind of going off of that on how drug courts are a specialized docket. So when there is a drug court case in a court, then the defendant can be sentenced to complete a drug court program. And essentially it's just court mandated treatment. And if you complete the program, then at the end of it, you could have your charges cleared. But there are many steps within that program. There are a lot of requirements in order to graduate. And so that's what we're talking about today, is those drug court programs that people work through after getting charged with a drug crime.
Thank you so much for that. I appreciate it. That gives us kind of just a base knowledge of what we're working with and what we're here to talk about tonight. And it kind of leads me into my next question. And I'm going to ask it, and then I'm going to turn some of our moderation over to Molly B. True, who is here this evening. She is one of our board members. She is wonderful, and I'm going to let her kind of continue the moderation for this evening. But the question I would like to ask is, as you started to begin to say, Allie, where are drug courts? Can you tell me a little bit about exactly where they are?
Yeah, so drug courts are all over the country, but Ohio has the second most amount of drug courts out of any other state, California being number one. So they're definitely prevalent in Ohio and deserve a lot of research. So they're in almost every county across the state at many different levels. So at like common pleas levels, at juvenile levels, at municipal court levels, we see drug courts in Ohio.
And to back up just a little bit, because I find sometimes people don't understand when you say common pleas and municipal and everything, just so we have a baseline understanding here. When you go to a county court or a common pleas court, you are essentially or usually there because you've been accused of committing a felony offense. Misdemeanor offenses, those generally get handled in your municipal court. So for instance, if you're in the Cleveland area, it's the difference between Cleveland and Cuyahoga County. And as Allie mentioned, we've got juvenile drug court dockets too. So they are throughout the court system here in Ohio.
Are they involved with family courts as well, or outside of that?
There are some in family courts as well.
All right, Molly, I'll leave it to you. We've covered what they are and where they are, and I believe our next for our panelists is, how do they work?
So essentially, when you're charged with a drug crime, you can be sent into drug court, and you work through multiple different phases of the program that have different levels of requirements. And within phase one, that could be the orientation phase, and then you go through and there are more required meetings, and certain days you need to be sober in order to progress to the next phase. And after you progress through all the phases, then you get to graduate. But there are a lot of challenges within those phases. It's definitely not designed to be an easy program. And there are many obstacles in order to get from one phase to another, let alone to graduate.
I have so some of the questions that I came up with were like, who determines who is eligible for drug court and who's not?
It appears that is left up to, I think I don't want to say, I think it would be inaccurate to say there are baseline standards, but I think there are some, but essentially it's up to the local court. to determine a lot of the eligibility for people. And you know, I know as tonight goes on, you know, I'll get a chance to talk a little bit more about some research and a report we did here at the ACLU of Ohio, but that was one of the questions that we were trying to figure out in contacting courts, is exactly who is eligible for these. And yeah, I think you know, Allie did a report and gets into this a little bit more, talking about some of the things that make you eligible or ineligible, let's say. So for some courts, it's a prior offense. For some courts, it's a violent offense. And I'm sure, and Allie can tell you better than I do, you probably have courts that it's both. And so, you know, there's a small list of things that will make you ineligible for a drug court. But the problem here in Ohio, if it is indeed a problem, is that there is not uniformity across drug courts. And that can cut both ways. You might have a particular community or a court or a judge or a few judges that handle things one way because of the demographics or other variables within their local community. There you can say that, you know, some discretion there from the judges in the court, that can be a good thing. But the bad part of this is, without that lack of uniformity with eligibility, it becomes extremely difficult to measure their success or lack of success. And I know certainly, you know, when people have gone and done court watching with regard to drug courts, you know, particularly, you know, and even in our big cities, it is glaring that you see an awful lot of white faces there, and you don't see a lot of people of color, including, again, in places like Hamilton County and Franklin County and Cuyahoga County.
I guess we can take this moment to kind of introduce Allie. She's a Harm Reduction Ohio Public Policy Fellow, and through her fellowship, she's researched Ohio drug courts and published a report on her findings. Lived 5 college. She's a junior, and yeah, this year in our system. So I think we can kind of turn this over to Allie to answer some of these questions and speak about her report.
Yeah, so when we're talking about what drug courts look like as a whole in Ohio, I'd like to take just a little bit to introduce my research from the summer. And I actually have a presentation I'll be sharing just to briefly give an overview of that. I'll share my screen. Right, so this summer, with the support of Harm Reduction Ohio, I had the opportunity to research drug courts in Ohio. And just to give a little overview of the objective of this research, it was to understand drug courts' long-term impacts and to amplify their participants' voices. Because across the state, we're funneling millions of dollars into these programs, but we don't really know what the outcomes look like, let alone from participants' perspectives and how it's impacting them. So as part of my research, I designed and executed this project to understand it from participants and to hear about their stories so that we can contextualize the success rates of drug courts and get a better understanding of them. So, and as part of this research, there were 2 parts. There was a survey and the interviews. So I created a survey on Qualtrics and distributed it through Harm Reduction Ohio social media, as well as our harm reduction partners. And we got 105 respondents to the survey in 36 of Ohio's 88 counties. We asked questions about they were all past drug court participants as respondents. We asked questions about their drug use, safety and frequency before, during, and after their time in drug court. We asked about the impact that it had on their mental health, on their substance use, if they thought it overall benefited them or harmed them. And we also asked some questions about if there were any harm reduction measures within their drug court. So if their drug court provided Narcan or educated anyone on safer drug use. And we also asked a question on if the participants knew anyone who overdosed from drug court. At the end of the survey, we had an open response section for respondents to tell their stories and experiences from drug court more in depth, and also a spot for them to leave their contact information. And 31 respondents left more information about their time in drug court that better contextualized their survey responses. And we had the opportunity to interview 18 respondents. And so this is just a map of Ohio and the different counties that were represented by this survey. So as you can see, it's pretty diverse all over Ohio, to give us a pretty good look at how drug courts work across the state. So some highlights from the survey. Survey respondents predominantly use drugs less frequently and more safely during and after drug court. And this graph is just one of many in my report on participants' drug use frequency after drug court. And those are the percentages of participants. And as you can see, participating in drug court overall decreased the drug use frequency of our respondents. We also found that Ohio drug courts have the potential to positively impact their participants' substance use and mental health. So 41.6% of our respondents said that they strongly agree that drug court helped them positively manage their substance use. And we saw similar responses on questions about positively managing mental health, as well as finding drug court overall beneficial. But this isn't the whole story that was told by the survey responses. We also saw a lack of harm reduction measures in drug courts. So drug courts have the overall goal of making sure their participants are abstinent from drugs, and they often leave little room for education and discussion of safer drug use. So for example, a large amount of respondents said that their drug court didn't provide Narcan, and many didn't know. So only 27.2% of our respondents' drug courts offered Narcan to them. And when looking at the connection between drug courts' abstinence as their top priority versus sharing information about safer drug use, we see that they often treat the two as if they're mutually exclusive when they don't have to be. So many strongly agree that drug abstinence was drug court's top priority, and many strongly disagree that drug court shared information about safer drug use. So they weren't sharing information on how to use drugs safely or overdose prevention. And so that leaves drug court participants susceptible to overdosing in cases of relapse, either during their time in drug court or after drug court. And we saw this reflected in the overdose rates that they reported. So 56.3% of the respondents knew someone who fatally overdosed after leaving an Ohio drug court. And of that 56.3%, they knew on average 6 individuals who fatally overdosed. And so those aren't the stories that were told in the survey. Those aren't the stories that we heard in the interviews. We don't know those stories. We don't know what led up to those overdoses, and we don't know the role drug court played in that. That's incredibly troubling, and having harm reduction measures would be a good first step in mitigating this problem. So we also did interviews of the survey respondents, as I mentioned. And so there were 2 different groups of responses that I put them in. So found that drug courts have the potential to help participants maintain their sobriety, provide support, and share access to resources. So one person I interviewed told me that drug court was the first time that they heard that they had worth as a person and that they had people believe in them. And so that is an incredible, impactful story, because that person wouldn't have received support otherwise. Some drug courts also offer support for housing and help people pay off their license reinstatement fees. So drug courts can be a force of helping people have community resources. But drug courts also have the potential to create immense harm in their participants' lives, and I also saw those stories reflected. So they can harm participants through unsupportive treatment team members, and in many cases, treatment team members who view the participants in their drug courts like criminals, like problems that need to be solved, or worse, problems that can't be solved. And that harms the participants, it leaves them behind, and it makes them feel dejected, and they don't feel supported in the program. Many drug court programs also have inflexible approaches to treatment. So Gary kind of talked about this in the beginning. Drug courts were created to have like flexible approaches to treatment, individualized treatment plans, so it's not a one-size-fits-all approach to treatment. But with that, they're also not taking in participant feedback or preferences when creating those treatment plans in many cases. So if a participant wants to go through medication-assisted treatment, or if a participant feels like 12-step is not working for them, they sometimes don't get a say at all in how their treatment looks. And so those inflexible approaches to treatment can also harm participants in the process. I also heard a couple of troubling reports of abuse within drug courts, of physical and emotional abuse from treatment team members onto participants. And those were unresolved because there's no way to record that or report that within drug courts in Ohio. So that kind of gets into the key recommendations that I found at the end of this research process that I provided at the end of the report. So some key recommendations, first looking at harm reduction. Drug courts should educate their participants on safer drug use and cases of relapse, and should also provide naloxone to prevent overdoses, whether it's a participant's community member who has overdosed or the participant themselves. Narcan can save lives. And Harm Reduction Ohio is an incredible resource on providing Narcan to those individuals and also providing that education for safer drug use. Drug courts should also commit to continued empathy and care for their participants, and viewing their participants as people with lives and with backgrounds and with mental illnesses, and not like problems and not like criminals. And so that needs to be a focus within drug courts. They also need to individualize treatment plans to reflect participants' preferences, because the flexibility of drug courts is meaningless if participants don't have autonomy over how their treatment looks. Drug courts also need to be held accountable to ensure equitable treatment. So Gary also talked a little bit about this at the beginning on the role of bias in drug courts, and how judges basically get to say anything and treatment team members get to say anything, and participants have to follow it, or else they could get kicked out of the program and sentenced to prison. So because there's so much flexibility within the program, there's a large room for bias and inequitable treatment between participants, which could potentially, and often in Ohio, be on the basis of race. And there should also be formal processes coming from the Supreme Court of Ohio that manage specialized dockets for filing and reviewing complaints within drug courts, because there are abuses, there are power misuses within drug courts, and those shouldn't go unreported. So this is just like a brief overlook of the research that I did during the summer, and that kind of just like sets the groundwork for today's panel on the state of Ohio's drug courts and what could be done about them, what are happening in them right now, and what the future should look like. So thank you so much for listening to my little brief TLDR of my research, but I'm excited to hear more from Gary and Sarah and their perspectives of drug courts as well. I'm going to stop sharing the screen and we can move back to panelist questions.
Okay, so are we moving on to Gary next, or
I think, if you want to ask the questions that we've prepared generally, and then the panelists can each raise their hand and talk to us a little bit about their expertise, and you can go make sure they don't step on top of each other.
good? Well, I mean, I've prepared a few questions. I did go through drug court in Hamilton County back in 2001, and at the time, MAT was not an option for drug court, while methadone is pretty much the gold standard in treatment for opioid dependence. We were expected to just go along with the AANA abstinence route. And so I'm curious to see how this has changed, and over what time period this has changed, and if it's changed everywhere, or what's the situation like now with medically assisted treatment such as Suboxone and methadone within drug court.
Hi. So my experience as of 2017 in my county, MAT was not an option. In fact, as of a couple years ago, in the common pleas court in my county, Vivitrol was also not an option. And it was discouraged in a really public way that I think is harmful. a lot of the you're trading one addiction for another, that kind of talk, it's not widely accepted around here. So that's what I can speak on as of the last couple years.
Is that just like the county that you were in, or has that been, do you have any experience with other counties, drug courts, or not?
So with the nature of my work, I get to work with a lot of people from all over Ohio.
Okay.
And from what I'm hearing, I think we're making some progress, but overall, I don't think people in a lot of drug courts are informed enough to understand that Vivitrol is not something that people are going to be able to abuse. And I'm hearing more people are not into it than are.
What do you think is causing that? And what do you think can what can be done to kind of educate and kind of point people in that direction within drug court?
Sure. Education, dialogue, conversation about it. So I think that with 12-step being the gold standard, because it was all we had for so long, right, of recovery, and people in those communities also discourage that. So when someone is finding success with MAT, they're not open about it. There's a certain amount of shame, because I think a lot of people, at least a lot of average citizens, see that as a crutch. They don't see it as somebody recovering. They don't see it as progress. So until people can have that conversation and talk about their success with MAT, I don't know how far we're going to get.
And just for the audience's understanding, if you don't know, MAT is medical assisted treatment, correct? Me if I'm wrong. Okay, just so everybody, in case someone wasn't aware, that's what that means.
And we did, ACLU of Ohio did a report that we released back in January of this year, which seems astounding because it feels like it was like 2 or 3 years ago, but it was just January of this year. So drug court's a snapshot of the system. And we asked, when we did records requests with courts around Ohio, one of the questions we did ask was about medication-assisted treatment. And as with a lot of responses we got from the courts, the answers were all across the board. Some courts do it. Some courts offer or are fine with some MAT drugs, substances, and not others. Some, when it comes to something like methadone, it might be that the court really doesn't deal with methadone as medication-assisted treatment because there's not a local provider there that can prescribe it to people. So sometimes it's a question of geography. Sometimes it's a question of the judge you might be before and their understanding of MAT treatment. Some courts take a very hands-off approach and say, that is between you and your doctor, your treatment provider, what have you. And so there was, as was sort of the theme of our report, there's no clear answers to any of this when you start trying to crunch the numbers across Ohio. It is so scattered around from court to court that you'll find, again, some courts doing it one way, some courts doing it another way, and other courts doing it somewhere in between.
Is there any just standard, I don't want to say rules or standard operating procedures for drug courts that they're required to follow to kind of prevent all this? Well, we do it this way and we do it this way.
Yes, there are some to be a specialized docket that is certified by the Supreme Court of Ohio. you do have to meet certain baseline standards to operate your drug court and get it funded. But they are very basic. And so, I'll back up a little bit just to talk about sort of the genesis of our report, and I'll do it quickly. So, I'm a lobbyist. I sit in the State House far too often, through hearing after hearing, bill after bill. And every 2 years, Ohio passes a budget bill. And so you get the department heads and everybody else coming in and testifying before the finance committee or someone else, talking about, why they think X amount of money should be allocated to whatever it is that they do. And every 2 years, I see an awful lot of money going to drug courts, year after year, budget after budget. And then we hear about an influx of federal dollars coming in, for drug prevention, and a lot of that gets siphoned off to drug courts. So I couldn't help but sit through hearing after hearing, year after year, and think, we spend millions of dollars doing this, but I'm not sure that anybody has looked into exactly how effective this is. What are we getting for our money? So we attempted to approach this as sort of, how might a journalist, let's say, approach it, or kind of your average Ohioan? If you wanted answers about these things, where would you look? Well, if you want to look for any kind of analysis of drug courts across Ohio, comparing them to each other and trying to get some sort of answer, you're not going to find it. I think the online, the most visible thing you'll see is a study about 20 years ago. Now, I know that there was some study done several years ago in Ohio, but you can't seem to find it online, or it's just not very visible, but people swear it exists. But this gets to our point. How are you supposed to find this information? Try to look on your local court's website for common pleas and find out the eligibility. Most courts are not going to find that information. So while there is, again, these baseline standards, what we were interested in at the ACLU of Ohio, because you hear about, such and such a court had so many people graduate, such and such a court has done such a good job, recidivism, that is, people not committing offenses that land them back in court and prison or jail. So, we wanted to know, when people talk about graduation, when they talk about recidivism, when they talk about eligibility, what exactly are we talking about here? And as I mentioned earlier, the theme of the report was essentially, it's all across the board. And we contacted, it was about 100 different drug courts across Ohio. Not all of them responded. And when courts did respond, it was good luck trying to figure out a lot of this. We put 1,200 hours into this. 2 staffers put 1,200 hours into analyzing 73 drug courts. And what one court considers graduation is different than what another court does. What one court considers recidivism is different than what, for some it might be 6 months you stay out of trouble. For another, it might be a year. Some courts say, we don't track that. Eligibility, again, as we mentioned earlier, a prior offense might get you not eligible. So the whole point of our report, while it started out originally as are drug courts in Ohio effective, the point of the report quickly turned into, how is anybody supposed to know how effective drug courts are, when it took us 1,200 hours to try to decipher this at the ACLU of Ohio, and we still can't give people an answer as to whether they are overall effective or not. So,
Okay.
so we have those baseline standards, but the more nuts and bolts of eligibility, recidivism, stuff like that, that's really, you got to search court by court, assuming the court has that information, or assuming that the court tracks that information.
And okay, so that informs a lot of some of the questions I'm going to ask next. So, we talked a little bit about MAP programs not really being eligible as a treatment program through many drug courts, at least to our understanding. Even other maintenance drugs are not an option. We haven't talked a lot about treatment plans like AA and NA. What other types of relationships between participants in like their mental health and maybe their recovery partnerships or these other agencies that they have to be routed to complete drug court, and barriers like payment to these? Are these inpatient, outpatient services? Sara, could you speak a little bit to that for me, please?
Sure. So again, I'm only speaking on my experience in my county, but there were 2 agencies involved in my county. There was an agency for mental health services, and there was one for the drug and alcohol services. I would say, if I had to guess, most participants received something like CareSource, Medicaid, that kind of thing. When it comes to those agencies, and this is something that Allie and I talked a lot about, that I'm really passionate about, the therapeutic alliance that a client should have with a provider is out the door, right? So these agencies,
Are we talking about barriers like trust and getting
Yeah.
to choose your provider, those kind of things? So that alliance of that not being prescribed to someone, or kind of because you've been criminalized, obviously, in drug court. This is a consequence. This is not something you've done of your own volition.
right? And so treatment is seen as punishment, and the people who you're going to for help are kind of, I always say, the long arm of the law. So you can't have that transparency with your provider, because they're reporting your actions to the judge, to your PO. So part of me feels like, what's the point? Because if you're not going to be honest with your providers, how much progress can you really make? And that isn't just in regards to like substance use. We're talking about mental health symptoms. So clients aren't going to want to report that to these providers, because then if they're viewed as unstable, they might be held at a level in court. They may not receive privileges. And some of those privileges include employment, because in a lot of these courts, you're not allowed to work for the first phase or whatever, because
But you're supposed to pay for treatment.
Well, yeah. And not only are you not allowed or discouraged from working, it's logistically impossible for most of these courts. That they're mandating so many meetings in a certain amount of time. That would be the 12-step meetings. You're going to appointments, you're checking in. There are daily drug screen opportunities where you would call and see if it's your day. So, it's I feel almost impossible to measure, like Gary's saying, to measure that success, because nobody's showing up and being honest, because you can't.
Okay, so we're talking about stigma here. We've mentioned it 3 or 4 different times. Are these prosecutors and attorneys and judges, who are sometimes appointed, sometimes elected, are they getting any kind of evidence-based harm reduction training, any type of understanding of stigma, mental health stigma, stigmas against people with opioid use disorder or substance use disorder? How are these folks being educated so that they can make informed good judgments? Is that something that's missing?
I would say yes, and without having the standard at a state level governing whether or not the treatment team is participating in trainings and they're up to date on the research. I mean, who knows? And I think that's the problem. Who knows?
Okay, so piggybacking off of that a little bit, we've talked about, what drug courts are and where they are, and now we're kind of talking about whether or not they work. It's crazy to me that we talked about 100 drug courts were contacted, 73 participated, and that's not everybody. We talked about county to county, these drug courts not working or being able to be regulated, or if you do something in one county and the neighboring county, you might have different results. And I'm assuming within the county, if there's different types of drug courts, that might not even be coherent. So what do you think the role of harm reduction in the courts is as it stands? And I would like any of the panelists to answer this one too.
As it stands, much like everything else when it comes to drug court, it's very localized. So as I saw in my survey and in the interviews, some drug courts are really up on harm reduction and offer Narcan and give safer drug use training, but the majority aren't. And so as it stands, there's very little role for harm reduction. And that's something I'm hoping Harm Reduction Ohio in the future can help address by partnering with drug courts, because drug courts are in the optimal position to provide safer drug use training and naloxone because they are so integrated with their community. There are many community partners on treatment teams. So they definitely have the resources and they have the support to do this. It's just a matter of actually integrating harm reduction into drug court models. But as it stands currently, there's not a lot of harm reduction. And if there is, it's just on a court by court basis.
Okay, I'm assuming a lot of the folks in drug court, not everybody, might be represented by public defenders who have heavy caseloads, who are trying to get the best outcomes for their clients, but might not necessarily be able to do everything they can for these individuals. Can we speak a little bit to how maybe we can break down some of these barriers for folks, what those barriers look like, and how we can fix those without overhauling the drug court system, but on an interpersonal level with the people who are in drug courts and their public defenders? Is anybody able to speak to that?
Actually, that's what I'm hoping to do next summer, is put together some educational materials with Harm Reduction Ohio and contact different drug courts and go from drug court to drug court and have workshops on safer drug use and provide naloxone. Because as I mentioned before, drug courts, one of the things that they advertise themselves as being really integrated and connected with their community, with treatment providers, with nonprofits, with just community members at large. And Harm Reduction Ohio is part of that community. So we could build that connection between drug courts and Harm Reduction Ohio to help the people in them.
Can we kind of give a summary of what we talked about, and each of you, if we haven't had the opportunity to speak about it, of what you think needs to happen now to improve drug courts, and what you think is being done right in drug courts that we could share with the drug courts who aren't implementing these practices to do things that might actually improve the lives of the folks who are participants?
I continually beat the drum on all kinds of mass incarceration and criminal justice issues about data collection. That it's 2021. You can get all kinds of information everywhere. You can drown yourself in information about all kinds of things. But nobody seems too wild to do this about drug courts. Exactly what we're talking about here. It shouldn't be the ACLU of Ohio. It shouldn't be Allie and Harm Reduction Ohio who are trying to peel back the layers on this, because we're only going to have so much success as essentially outsiders. We are not the courts, we are not the judges, and that control a lot of this information and these decisions. So I would love to see a statewide law or policy or whatever we can get that really does say, this is what it means by graduation rate. This is what it means, tracking recidivism and what that means. This is what it means, with regards to eligibility. Again, maybe there's some room there for a little bit of discretion at the local level, but we have to have something that can be analyzed across Ohio, no matter what city or county or court that you are in, so we can answer globally, do drug courts work or not? I'm not one of these people that sits here and says drug courts don't work, because it is clear for some people drug courts work. But what I don't know, and I don't know that anybody anywhere knows, is which people does it work for? Why does it work for them? Why doesn't it work for other people? And again, we've been doing this for over 20 years with this, and there seems to be, just a real lack of leadership with regard to getting to the bottom of these answers. We just seem to, and when you look at a lot of press accounts, a lot of media reports about these kinds of things, to me, they read essentially like press releases from the local judge. Nobody is doing what Allie did. That's I think hers is so valuable. You can look at it and you can say, well, it's only 18 people, but it's 18 more people than the press seems to dig into with this. It seems like, the standard newspaper article is, go to the judge that wants to talk to you. They will trot out one or two people who successfully completed drug court and got their life back together. I want to hear about the people that drug court didn't work for or didn't work so good for, so that we can determine how to make drug courts better if we are going to do drug courts.
So transparency, just in the effort to like do better, like without the shame, but just some accountability and growth. That was a wonderful opportunity for me to kind of segue into the next section of our panel tonight. I think if Sarah or Molly would like to share their story, they talked a little bit about their experiences in 2001 and 2017 in different Ohio drug courts. After they kind of talk about anything, if they would like to, we're going to take some questions from members of the audience. If you're watching on Facebook, unfortunately, we won't get your questions in real time. You can try to comment, and we'll try to pull those, but there'll be a little bit of a lag. But our other guests, if you would like to type a question into the chat box, to me or to Molly, one of us will ask that for you, and then we'll have maybe some time for a couple of stories so we can hear from people who have been through drug courts or participated with clients in drug court, and if we could keep those stories to 3 minutes or less so everybody who would like to participate can. But if Sarah or Molly, if one of you would like to begin kind of sharing what your experience was, if you're welcome up to it, we would appreciate that. One second, Molly, you're muted. I'll get you. Hold on.
Yeah, so in 2001, I got a slew of drug charges all at once, and was put into drug court in Hamilton County. While I was in the Justice Center waiting to be transferred to drug court and get that going, I was put on a lot of really heavy duty psychotropic medications, including like Halidol, Cogentin, Seroquel, Ativan. And when I finally did get sentenced to go to ADAPT, which is a popular like lockdown, semi-lockdown inpatient treatment program, I was sent there, and they took me off all the medication that I'd been on for 6 months. I had I guess the best way to describe it is a psychotic episode. I was sent to psych emergency room at UC and prescribed other medications that they thought were allowed at ADAPT, and I was sent back to ADAPT. And during this psychosis, I went into White Castle and took a 3-month supply of 3 separate medications, and in trying to kill myself. I ended up in the emergency room in the psych ward, and the whole situation was just handled just backwards. If you ask me, I think that what's it called? Dual diagnosis is very, very prominent in many people who suffer from the disease of addiction, and that was not taken into consideration in my case, and it put my life at risk.
So not only were they not meeting your needs to treat your substance use disorder, but they allowed your mental health to get at such high risk that you not only endangered yourself, but others potentially, and could have caused trauma to others who would have found you in that state. And there was no support system. It sounds like there was nobody, besides policing you, there was nobody monitoring your wellness and your well-being. When you were in this facility, did you get to control your own medications, or were they controlled for you?
Well, when I went to the facility, the first week I was there, they just completely took me off all the medication that I'd been on at the Justice Center. And, these are heavy duty, antipsychotics, and they just stopped them completely. I began to have a nervous breakdown, was sent to psych ER, and prescribed other medications that were allowed at DAPT. And by that point, I was in such a mental breakdown that I was ready to kill myself.
I'm so sorry that happened to you. Thank you so much for sharing that with us tonight. I'm so glad you are here, and I am grateful that you would share your story so that others don't have to suffer in the same way, and that you can advocate for people who did not have a voice. So really, truly, Molly, thank you so much for still being here and sharing tonight. That's serious, and I'm really, really sorry that you weren't respected and cared for, because you are worthy. No matter what your illness is, or no matter what drugs you take, you're important.
Thank you. And
Yeah.
that being said, though I did have not the greatest experience with drug court, I've learned in life to take what I need and leave the rest. And that's something that I've learned over the years. And I was introduced to AA, and I was introduced to a lot of like positive things through drug court, and I try and focus on those things today instead of point fingers, and do what I can to work towards change.
Thank you, Molly. Thank you. Thank you for being here tonight, because that's exactly what we're trying to do, create policy to make change, lasting change. Sarah, would you want to share your experience, please?
Sure. So much like Molly, I had a lot of experiences for which I'm grateful, right? So I had a period of abstinence that allowed me to really reflect and figure out who I am and what I need and my preferences again, because for those of us who used in excess to the point of being in a drug court, I didn't know who I was or what I needed. So that period did give me that clarity. I had access to resources. I had a good experience with that. However, I'm conflicted, because I know that some of my peers in my court didn't have the same experience that I had, right? So when we reflect on privilege, I know that I had a better experience because I had a voice to advocate for myself. And I had the privilege of being respected and listened to even before I said anything, because I'm showing up in a court like this from I had advantages personally that set me up for success in this court. I had support from my family. I had a willingness to get my stuff together. And I think that made me more appealing as a participant in this court. So I think that treatment providers and members of, the whole program were more motivated to help me because I didn't need quite as much help and I was self-directed. And I think that that's one of the problems with these courts, is when someone isn't meeting all of the requirements, they're very often given disciplinary action, they're kicked out, they're sent to jail, because it takes a little more effort to help these people. So I had a lot of, I still to this day, 4 years later, struggle with a little bit of survivor's guilt in a way, because I know all of the great things that I got to experience and to this day continue to experience because of this court. Whereas there are 3 participants I know who are dead, right? Several more who are in jail. So I struggle with it. I struggle with feeling satisfied knowing that I had those advantages that a lot of other people didn't.
Thank you so much for speaking about your privilege and what a success of a support system does, and being set up and having a willing heart and being ready for that kind of change and mediation in your behaviors, because that's what this is. It's behavioral mediation, you know what I mean? And whether it's good or bad, if you're not willing, then it's going to be traumatic, and something that we haven't talked about, and I think I'd be remiss not to mention, is that people of the global majority, black and brown people, indigenous people, are hugely discriminated against in drug courts. They are disadvantaged just like in everything else in life. And I think it would be almost a violence of us not to mention that happens to those folks, and they're disproportionately disadvantaged. And so thank you so much for sharing that. And please don't feel shame or guilt for surviving, because look what you're doing. Because of you went through that, you're here tonight helping, and you plan to graduate and help more and more folks, and you're spreading awareness and education, and you're doing good work, Sara. So thank you. Okay, we have about 19 minutes left in this evening's policy panel. So I'm going to open the floor up to our guests if they have any questions, and then give the panelists a chance to share anything if they have anything on their hearts to share this evening that we had not yet gotten to discuss. So please, if you would like to ask a question tonight, please direct message me, Amanda Reese, in the chat, and I will share your question with our panelists, or give you the floor to share your story if you think there's something we need to hear. Okay, our first question is anonymous, and it is, why are there so many differences from county to county with courts, and is funding an issue with okay, so what they're asking is, do graduation rates, what things affect the funding, and is that kind of why the courts are different county to county or within counties, because they're funded differently and have different resources? Can anyone speak to that?
I don't know how it breaks down on that level, sort of the inside funding part. I mean, it's another thing we tried to take a crack at with our report was budgets for the courts, and where they're getting money from and how that money is allocated. And again, because there's no uniformity about how to report that, the budget stuff was particularly messy, because some courts would respond with like the total budget for like all the specialized dockets, and some would respond with just the drug court. I mean, and then there were, individual discrepancies within there. So again, going back to that theme of, who exactly knows with this. But I will also say largely, more globally, and I'm sure this is not exclusive to Ohio, but judges love discretion on all kinds of things, or I should say basically everything. Judges are kind of used to being the queens and kings and the queens of the castle, and they don't like people by and large telling them what to do and how to run their court. And so, I could see where, there is that, as we've discussed here, where some of that discretion might be advantageous from area to area or court to court. At the same time, in so many different ways I've seen over the years, judges, trying to preserve any amount or all discretion that they can, and also fighting accountability in some ways when it comes to, my suspicion, with a lot of times when you discover that data is not being collected or that studies aren't being done, a fair amount of times that's on purpose, because people don't want to know what those answers are exactly, because, we might have to blow everything up and start doing this differently. And, we've been doing this for 20, 25 years, et cetera, et cetera. So combination of two things, judges just, they love discretion and will fight every effort that takes any amount of discretion away from them. And then again, those differences from court to court.
Gotcha. Okay, and I can imagine there's not a lot of policing being done on judges, as, like you said, they're the kings and queens of their kingdoms. We have a guest who, Will, who shared something I'm going to read for you. He says, I have seen many drug court proponents and judges explicitly oppose the decriminalization of simple drug possession and insist that the drug court model requires prohibition. But I'm convinced years of research have shown the case for decriminalization is overwhelmingly strong, and there is no good defenses of prohibition. How many of the major figures in the drug court system or movement today support decriminalization and believe that some kind of drug court model is needed or is indeed compatible with it? I can only support a drug court model that is supportive of decriminalization, not any that oppose it. So we want decriminalization, and what do we think this could do for the drug courts, and are there any that support it right now in Ohio or potentially globally?
I would assume that, I don't know the answer to, like, sort of on an individual basis, if you would find any champions on an issue of decriminalization or even legalization of almost any substance out there. I mean, while sort of the country rushes to legalize marijuana, we still haven't even done that here in Ohio. But you can't even have, I've tried to have these discussions with legislators and other elected officials. Decriminalization or legalization, that's not even on the table in Ohio as far as a discussion with almost everybody. The idea is, how do we tinker with the existing system, and in this case, drug courts? Maybe some people will get there to that point, but I like to take a look at these things, as I think everybody that would tune into something like this knows. We've been doing this for about 50 years, this war on drugs, half a century, multiple generations of people. But you can still find the same drugs that you could 50 years ago at essentially the same prices. And you have, if not the same, more people getting addicted and overdosing. And after 50 years, I think it's a fair question to say, perhaps it's time for a change.
Oh, absolutely.
The same thing applies to drug courts. So we've now been doing this for, let's say, 20 years. Certainly it is having a positive effect on some people's lives, but systemically, culturally, socially, again, you can still find all those same drugs at those same prices, every bit as available as they've ever been before, and we still have what is, a drug crisis and an overdose and death crisis here in Ohio and elsewhere. So clearly, things are not working the way that we have been doing them for whether it's the past 20 or the past 50 years.
We have a couple of questions. One is, what can folks who do direct services, like social workers or nurses or people in public health, do to help participants who may be involved in drug courts or to advocate for change in drug courts on a local level? Do you have any advice for them?
I'll take a crack at it since nobody's jumping to it yet, because it's a difficult question. And I think one thing, I don't have all the answers by any means. I wish I did, but I do think something that is vitally important is exactly what's going on here tonight, where you can have people who have been impacted by this, who have not only had drug problems, but have gone through the legal system and have gone through drug courts, telling people how it is for them, what they saw with other people, their own experiences, because we're not getting this by and large. Like I said, media coverage of this essentially reads or sounds like a press release, and we need to, not only with drug courts, but across the criminal legal system and mass incarceration, listen to those people who are impacted by this and truly listen to them with regard to what would help, what we need more of, what we need less of. But, and again, that's why, Harm Reduction Ohio's report with Allie there is so valuable, because, we're hearing from at least 18 people here sharing their experiences. And I would love to see, 180 people or 1,800 people. But, that's not the kind of thing I imagine Harm Reduction Ohio or ACLU or anybody has the capacity for. They could find the capacity, the government officials, the elected officials, and everybody, if they were to make it a priority. But they need to make it a priority.
Somebody else would like to share their story anonymously. To summarize it, They had received a drug charge of cannabis possession in the early aughts, 2005 or 2006, and psilocybin, less than 0.1 of a gram of psilocybin. It might have shared a baggie or something. They were enrolled full-time as a student, and unfortunately, to maintain their scholarships and other federal student aid, they had to get that rescinded from their record, so they went through the drug courts. And what was frustrating for them was they did not have substance use disorder, and so they had to take a spot in this treatment program, go through 11 months of treatment, 3 nights a week outpatient, pay all these fees in courts, do community service, and pee in a cup 2 or 3 times a week, and all of this to get the charge dismissed or down to some sort of other charge that wasn't drugs, so they would not lose their funding for school. And it feels corrupt to them because they did not have a substance use problem, and they were not allowed to leave their outpatient program until they admitted to having one, even though they never had a dirty drug screen, and then were asked to do other mental health treatment programs afterwards. They felt very much like it was like a capitalist kind of trap. They had to do some, it looks like anger management courses, some other diagnosis, talked to lots of psychologists and psychiatrists, and it was traumatic on their life, and also just very frustrating as a full-time student who also had to work to pay for college and to receive their funding, to have to go through the whole drug court system and graduate. And they feel they're also a good candidate like Sara. They're educated, had a support system, had a transportation to get to these programs, and it did leave an impact on them that it's pretty corrupt. They want to know how many participants go through Ohio drug courts, if anyone knows, and what you think, if you have any idea, the average of folks who are going through them that don't have substance use disorder, alcohol, or some sort of opioid use disorder. They say largely the people they went to the AA meetings, which they were required to go to, with they were unable to find a sponsor because a sponsor wouldn't take them seriously. Just a lot of obstacles, and they wonder how often this happens.
Of course, we don't know because we don't know anything, but I would say that's probably a frequent occurrence. Especially the people that my peers who had like a DUI. I mean, I don't want to minimize drinking and driving. Of course, it's harmful, but there were participants in my court that, I'm very shocked that they would meet diagnostic criteria for a substance use disorder. Very shocked. And I don't know if there's something at play there, like about their representation in court. And I really don't know, but that's something that I can confirm happens.
Thank you for that.
It's that great irony. I had mentioned it in the beginning of the purpose of drug courts is really to do not a one-size-fits-all approach. That there's supposed to be that flexibility and recognition of people's individual circumstances. But then you see people go through drug courts and they get, pigeonholed into basically a one-size-fits-all approach.
After sharing that story, we have 6 people in the chat saying they had a similar experience to that one. So I'm going to say it might be overwhelming. I know that's anecdotal, but that's why we're having these discussions to kind of see what is out there and what people's experiences are. We have about 5 minutes left in the panel, so I would like to ask all of our panelists tonight and Molly if there's anything else on their heart that they would like to share, what they think the next steps in change like this could be, how we keep these discussions going, and just thank you guys for being here tonight, and we'll do some closing remarks after I allow you to have the floor.
I would say the best next steps for drug courts in Ohio would be education and accountability. So education of drug court participants on harm reduction, how to use drugs safely, giving them Narcan, both for themselves and for their friends, other community members, just keeping everyone safe. Also education of drug court treatment team members. And so within hiring processes, perhaps screening for people who view addiction as a criminal act rather than a mental illness, and also accountability. So accountability for drug courts statewide, to ensure equitable treatment between participants, to have formal review processes for complaints of abuse and misuse of power, and just data collection overall. That's something Gary talked a lot about, so I don't want to beat the dead horse, but there's a huge need for more data on drug courts, because my report doesn't paint a full picture of Ohio drug courts. The ACLU's report doesn't paint a full picture. There is no full picture. So there needs to be steps statewide to understand the impacts of drug courts more broadly.
And I wanted to ask one question to just pop up in relation to that. How often are undocumented people or people seeking green cards or other immigration status affected by drug court and in negative ways? And is that happening here in Ohio?
I don't have an answer to that. I wish I did, but I'm not sure. I don't know if Gary or Sara does, but I'm sorry.
I don't have a particular answer, but putting on sort of the immigrants' rights advocacy hat on this, I mean, a felony drug charge can get you deported if you are here and not a citizen of the United States. So, I think for some people, I don't know how many, I don't know how widespread it is, but drug court, to the extent it does help, isn't even a possibility for some people because you're here undocumented, or you're here and you're not a full-fledged citizen. Again, you could see yourself deported because of you pick up a felony drug charge.
So again, another eligibility criteria loophole or pitfall. And so again, Sara and Gary, if you have Molly, if you have anything else to share, we have 3 minutes left tonight.
Allie, I want to thank Allie, because this is some work that even as a participant in a court, as a social work major, as a chemical dependency counselor's assistant, after completing that, it kind of was like, okay, that's over, I can forget it. I saw this survey and I became it fueled an interest in this thing that I know a lot about, that I have the voice, so thank you, Allie, for kind of start lighting that fire.
Yes. Molly?
Yeah, I couldn't agree with what Sara said more. Allie, as your work with this analysis of the Ohio drug courts was just phenomenal, and it's the beginning of a discussion that is long overdue, and I know there's been a lot of progress over the years, but there's much more that's needed, and education, bringing that harm reduction aspect in. I don't know anybody that just got into drug court and was like, oh, I'm gonna put down heroin today because I might go to jail if I violate. That's just not works.
Thank you.
I think that that there's a lot of things that need to be looked at, and I think that everybody needs to be on the same page. And I really want to thank everybody for participating and all the hard work that they put into this.
Yeah, thank you, Molly, Gary, Sara, Allie. Thank you, Dennis, our CEO and founder, president. He's our fearless leader who made Harm Reduction Ohio happen, hired our wonderful public health fellows that wrote these amazing reports that we're having all these policy panels about. I want to take this moment not only to thank all of our panelists for participating tonight, but thank you for doing the work that nobody else is doing. Thank you, because it is unpaid, it is not advocated for, it is unrecognized, and without your work, nothing is going to change, and people are going to keep dying. Because at the end of the day, this stigma, these broken systems, and this inability to have accountability means there's no healing. Without accountability, we cannot heal. I'll take this last minute of our policy tonight to plug next Monday. We will be meeting here at the same time. You can get tickets on Eventbrite or through Facebook. And we would really like it if you guys could read Allie's report. It is on our website. Again, that link is in the chat. Thank you, everybody, for joining us tonight. This will be recorded, so you can watch it later if you missed it or came in and out. And we will hopefully see you next Monday night at 7 o'clock. Thank you so much for joining us tonight, and have a good evening and enjoy the rest of your week.